Coming up on today's episode of the Health Review.
Men feel that they can't seek help, probably because that's what they saw.
Where do you think we are falling short for men in particular?
When testosterone levels drop, one of the first signs and symptoms that, again, men are typically quite embarrassed to talk about, but actually it's quite commonplace, is erectile dysfunction. And that typically manifests as loss of morning erections. It could be the case that erectile dysfunction picked up early enough could highlight problems elsewhere in the body. So it can be a very good early predictor for cardiovascular disease. Testosterone levels tend to peak in the 20s, and then from the mid-30s to 40s onwards will start to decline.
Is it a slow decline?
It is, but there's always caveats.
Hello, welcome back to the show. Now, today I'm going to be talking about something which I've really wanted to cover for a very long time. It's men's health. When it comes to health, men are often the last to speak up and the first to skip those all-important checkups. And despite all of the amazing medical advances that have been happening in recent years, men are still dying younger. They're suffering in silence and they're under-reporting their health concerns. This is highlighted in a report in 2024 by the Men's Health Forum, which said that 1 in 5 men dies before the age of 65 in the UK. And men are less likely than women to visit a doctor, even when they show clear symptoms of some sort of chronic illness. So I'd love to get to the bottom of all of this, why, men are suffering with hormonal imbalances, sexual health issues, and why they're frequently overlooked or dismissed. And to help answer all of these questions today, I am joined by Dr. Jonathan Andrews, a medical doctor and healthcare innovator who's deeply involved in reshaping how we think about and deliver men's healthcare. Dr. Andrews is the medical director at TEDS Health, a fast-growing men's health platform, and also advises a range of healthcare tech companies on clinical and regulatory strategy. And on top of all of that, he still works on the NHS frontline in urgent care, bringing a rare dual perspective from both traditional and tech-led medicine. Jonathan, that's a lot. You've got a lot going on. Thank you for coming on the Health Review.
Thank you for having me, Emily. And thanks for the intro as well.
Absolutely. I mean, gosh, you're a busy, busy man. You wear many hats. As I've said, NHS doctor, which a lot of us, based in the UK, know what we get an idea of what that involves. Stressful job. Medical director, working with startups. What has drawn you specifically to TEDS Health and the mission that's going on there?
Thank you. I think that's a really good question, a really good one to start on. I think actually if I look at how things have panned out in my career and my life, it's been quite purpose-driven. I think the call for most people to become a doctor is really, purpose-driven as well. Most people go into medical school with the goal of wanting to hopefully improve health and help people. That was certainly the case for me, but I think sadly, and I think we see a lot of that in the press now with, strikes and lots of issues and burnout and obviously sadly people leaving the healthcare profession. I'm not just talking about doctors, but actually across the board of the workforce and not just in the UK alone. But that's a slightly separate issue. But I think that's because actually, the reality of healthcare delivery is that it is, it's constant, and it can be really, really tough. And as such, I think it's very easy to burn out. And I think when I looked at aspects of what I was doing in frontline care delivery and thinking, where could I make better and bigger impact? That kind of brought me towards a lot of the stuff that I started doing with tech companies, so startups and scale-ups over the last few years. And I think we're in a really kind of interesting point now, obviously with AI, but even if you look at everything since the kind of dot-com era, which I've kind of grown up through and, being used to using technology when it first came out. So, consoles and video games and mobile phones and computers and the internet and now where we are with even AI. And you see the kind of the growth of companies that have really transformed the world as we know. And I'm not talking just healthcare or talking about kind of, enterprise cases that the common public don't see. I'm talking about even kind of on a consumer level, like consumer apps and websites that we all use for booking holidays, for ordering food, for ordering a car to come and pick you up. And that convenience, that accessibility. And if you see how a lot of those things have shaped experience and user experience, that's really become very personalized. And I think sadly, and you'll hear this, it's kind of a very common thing that so many people are banging around saying, well, healthcare isn't very personalized. It's not changed. It's not evolved. It's still like what it used to be in the, 100 years ago in many respects. Paternalistic medicine, really, it's more the case that you book to go and see a doctor. You then wait a very long period of time. A lot might have changed in that period. And when you finally do get to see someone, you get very little time with them. And you're probably told what to do. And that's that. And I think over the decades, we've had obviously a growing and aging population with increased pressures. There's increased burden of disease. And sure, some of that is, if you like, man-made influence by diet and lifestyle. And there's so many other factors there. But if we think about what that means, essentially people are getting less time with their healthcare professionals. And at the same time, you've seen actually, well, people are starting to turn to what it used to be was Google. People turn to search engines. And now they're turning to large language models, right? So people are going and saying, well, ChatGPT told me this. And it's not uncommon in the last few years that patients will come in and have something either printed or just show it on their phone, what ChatGPT said this. And things have got better and better and better to the point where there are now tools out there which actually are providing actually high quality evidence-based, well, I wouldn't say advice, but evidence. So actually it's getting harder and harder as a clinician and a so-called expert in any particular medical specialty to actually be at the top of your game, because actually the technology is really caught up and it's empowered people. But coming back to kind of my why and what's led me to where I am and being the medical director at TED's Health, I saw a real big problem with kind of disparity and inequality across the board. I mean, from sort of 15, 20 years ago, my parents were involved in care homes. And actually, before even becoming a doctor, one of my first few experiences was first volunteering in kind of neurodisability homes and then later nursing homes. So I kind of got that exposure to kind of aging. I actually then did a module in a BSc focused on aging. I mean, sort of pre all the longevity stuff, I was very interested in kind of how we could reverse that, what causes it. So that was one area of interest that I saw. There was huge disparity with a growing and aging population. There needed to be something done. But other things I saw, obviously, women's health has been a huge area which is still so underlooked and so much work to be done. But on the flip side, I also saw that men's health didn't have equally as much innovation. Yeah. Or even, and it hadn't been looked at enough as well. And I think, again, there's lots of reasons there, and I'm sure we'll unpick some of those. But I felt particularly drawn to that as a man myself, to say, well, what could we do about that? How could we potentially make things better? And I guess part of being a doctor is liking to solve problems. And so I've been drawn to trying to look at how we can solve a problem for particularly maybe one sector and be able to expand on those thinkings for other sectors as well. So I think potentially some of the learnings which might be applicable to, say, men may also be applicable to lots of other different sectors as well. So yeah, I'm really kind of trying to draw upon everything that I've kind of done over the years, and I think I feel kind of quite passionate about obviously men's health, and that's what's led me here.
I love the mission and the journey that you're on with all of this. And I think 2 points that you made about accessibility and convenience, I really think as a society, that's what we're looking for these days. And I think that's why so many people are turning to tech companies, private healthcare, testing companies, because they just want to take back control. And it's brilliant. And I think this probably also suits men a lot as well, because I think for guys it's difficult to get them in the room to talk about their vulnerabilities. This also kind of adds an element of privacy to it, where you don't have that openness where you have to go and be open about potentially embarrassing things. And I do think as women, we're very used to it, because from a young age, you might go to the doctors and talk about your periods or your contraception, and you go for smear tests and pregnancies. I think with women's health, that's been championed now for a long time. At least the messaging, especially on social media, we're all sharing our embarrassing stories, and there are taboo, topics. But you really don't hear this happening in the men's health spaces. And I wonder if it is partly that, like, not wanting to be vulnerable and having to be tough and having to tough it up and be strong. And I used to suffer with really bad chronic UTIs and kidney infections, and I saw a urologist, and I was saying, you know, gosh, it's so sometimes really difficult being a woman. And I had a male urologist, and he says, yeah, but you have no idea how men suffer with their prostate as they get older. And I was like, never heard of that, never heard about prostate issues. Obviously now, like, you know, there's a little bit more education, but just generally, there's not a lot of awareness about some men's health issues. So I think what you guys are doing at Ted's Health is really important.
Thank you.
Where do you think we are falling short for men in particular? Where are the main issues, like as a system or as a society, would you say?
So I think, as you just said, that last point, so there are societal issues, and I think that stems from perhaps cultural perspectives. I mean, what does it mean to be a man versus a woman? And I think, you know, how the role of genders has sort of played out over the last decade or decades. So I think, you know, in 2025, things are very different to what it might have been 40 years ago. But I think, I mean, there's so many other kind of nuanced factors there as well. I think awareness is kind of generally getting better at, across the board when it comes to healthcare. And I think the wellness industry, which, you know, I mean, as a healthcare professional myself, like there are lots of things in the wellness industry that we wouldn't necessarily agree with, you know, mostly a lot of wellness things being unregulated and sometimes in many cases actually contradicting kind of evidence-based medicine, for example. But actually, I think people's attitudes towards their health has probably actually been, in some cases, positively driven by awareness from, you know, wellness and some, in some part, perhaps also influencers and availability of, you know, whether that's tests, whether that's products, whether it's services, whether that is, you know, the private sector or state-led socialized care like the NHS. So I think a lot of things have happened. I think we can't deny one elephant in the room, which has radically changed healthcare and how we view health in the last few years is the COVID-19 pandemic. I think for many people, and I've got quite a few stories on sitting on different sides of that, you know, having been actually setting up a testing provider and doing lots of different things during COVID, as well as also working on the front lines. But I have definitely seen attitudes change towards health and interest in kind of actually testing, which from our side, or what we do at Ted's Health, looking at testosterone, that's obviously a big part of it. I mean, you can't know if you've got a deficiency without testing. But obviously, to even get someone to be able to do a test, purchase a test, do a test, go to a GP, even speak to someone, you need to raise awareness. You know, I've spent a bit of time actually also learning and being involved with marketing from a healthcare perspective, which might seem a little bit odd for a doctor to do, but many years back before I became a doctor, but I'd done my degree that I said where I was doing a lot of aging research. I had a year while I was waiting for medical school and ended up working in corporate sales, but then ended up in the marketing division of that company. So I kind of I saw it, you know, my world opened up and I was like, oh wow, this is really why people buy things or do things, or what are the real motivators and drivers behind human behavior. And it's very interesting taking a lot of these learnings into kind of what we do now. And I can now really see sometimes, so obviously, why people don't engage with healthcare and services and systems. And that might be because messaging is outdated, or it's not cool, or it's just not hitting home in the right way, or it's not on the right platform. It's boring. And so, again, talking about kind of traditional healthcare models being kind of very outdated, it's no surprise that actually people are going elsewhere and looking elsewhere. And I think one thing I'm very passionate about is trying to just drive awareness with no ulterior motive myself. Like, frankly, if I can, you know, provide information from an educational perspective, which is, you know, unbiased and balanced and can lead to someone actually hopefully doing something with that, then you know, that's a net gain for society. So coming back to kind of saying why did I become a doctor from trying to, you know, lead to bigger impact, that's you know, part of my role. So yes, it's great treating patients and one-to-one and prescribing, and I do a lot of that in practice in the NHS and also privately as well. But actually awareness is one of the biggest things. And awareness can just be about kind of lifestyle and checking your own symptoms and things like that. And kind of to answer the question just asked about kind of the attitudes towards men's health. So society kind of sometimes dictates the blueprint or the model that you go through, right? So that becomes your ego. And I think men feel that they can't seek help, probably because that's what they saw. And many times you'll hear that actually a lot of health issues, and especially if you talk about mental health, stem from childhood and development. Those are the key formative years. And I think in many respects as well, you will actually see that how, I guess, the children of today now see, their parents and the surrounding kind of society around them engage with healthcare is probably what's actually going to be the case in 20, 30 years time. So I think if we do want to shift the narrative to kind of more awareness, but also transparency and engagement and talking, with healthcare professionals, then I think that needs to be modeled as well. It can't be something we just expect.
Definitely. And it almost comes back to the family sort of attitudes as well. And I think in the UK, there's often been this just sort of getting on with it type mentality, perhaps being private, parents not telling your children when they're going through health issues, which doesn't help because it becomes almost like this secret thing where you don't really open up about your health. And actually having people around me who grew up overseas in various places find it really bizarre that British people in particular put up with illness and problems and don't fix things. I do think there's something to that sort of need for openness, need for society to kind of be more accepting, especially for men, encouraging men to be open about their mental health, open about some of these issues, not being embarrassed. What are some of the key issues that men are facing with their health, which perhaps they are avoiding going to see a doctor for? Things like testosterone, which are slightly more taboo, perhaps.
I'll maybe get to testosterone last, only because there's probably as you say, it's taboo. So I think that's probably a big part of it. But even really simple things, and I can cite numerous examples, but maybe if I was to cherry pick a few from my kind of NHS practice, I once had a man come in into urgent care during the pandemic. Came in with chest pain. Now, chest pain, when they come into urgent care or A&E, is usually treated very seriously. So you kind of say, okay, and we go through the whole kind of screening to see, is this person potentially having a cardiovascular event? But actually, very quickly he said, in the first few questions, how long has it been going on for? 1 year. The same intensity, all of that. So basically, I said, why did you come in today? And he essentially said, look, it was the only day I managed to get off work. It's actually, he said, look, there's no specific reason I've come in today. It's no worse. It's no better, but it's no worse. And I hadn't been particularly bothered before, but it was a day off. I thought I'd come in. And that's just one example, but I think what that shows me versus some of the examples he said, whereas maybe women are more familiar with speaking about it, and then therefore maybe saying, a friend or someone might say, well, maybe you should go to a doctor, is I guess this poor man was, presumably working very hard. And it finally got to the point where he just had that one day off that he decided to deal with it. So it's kind of kicking the problem down the road. And I think as a result, what we do find, which you've touched on at the beginning, is that cardiovascular disease, which is, one of the most preventable areas of healthcare, but responsible for a lot of morbidity and mortality, really, it's significantly worse with men. And again, there's several factors here, and we won't necessarily unpick all of them, but I really do think a big part of it is because men don't seek any input early on. And what that means is if you don't really engage with a healthcare provider early on, you might not identify any problems to be able to actually look to try and correct them. And quite often it's a very, very familiar story to either hear or see firsthand that, somebody comes in an ambulance having had a heart attack, which could have easily been, potentially prevented. And actually when you hear them, they say, I've been just working so hard, I've been stressed and that. And all the warning signs were there. Even looking at the person, you probably see all the warning signs were there. It's a real shame. And I think, again, that's perhaps societal driven as well. There's expectation that men should be the breadwinner, should always be working, should not be complaining, should not be taking any time off. And I think it's such a shame to see that reflect into kind of healthcare behaviors that can have net negative effects. And of course, what's the worst thing there is that those effects then affect everyone else around them. So it kind of has the complete opposite effect of what it should have been doing, really. So if they wanted to be actually supporting everyone around them, then actually they should have been taking a little bit of time for themselves. And I think, because we've historically kind of poo-pooed kind of time for yourself, that self-care, that's not a thing that blokes do. That's kind of also not helped the narrative.
Sorry to interrupt. If you're enjoying today's episode, please do subscribe or give it a follow so we can keep giving you excellent content and bringing on amazing guests that hopefully you're loving on the Health Review podcast. Now back to the show. Plus the lack of connection to our bodies. I think we've lost that. A lot of people, I think if you're not in a great space with your health, perhaps, not eating the best diet, drinking alcohol regularly, not sleeping, I really do think you lose that ability to actually sense, like, how am I doing? As a woman, it's very beneficial for cycles, understanding hormones, but same for men too, right? To actually know what's the natural rhythms of their body. I guess testosterone changes throughout the day and, energy levels and things like that. And perhaps, a lot of people wouldn't even know if they're really deficient in testosterone or other sort of common health issues.
So yeah, we didn't get to testosterone, but that's a good segue into it. But I think, so, cardiovascular disease, I said that's kind of a common one, and that's something we see. Prostate issues and obviously prostate cancer. And I think there's a lot of awareness now on that. I think there's the statistic that I'm seeing everywhere on billboards is 1 in 8 men have prostate cancer.
How often should men get their prostate checked?
This is a very good question. I think there's been a massive surge in people going to see a GP, now getting a blood test or a prostate examination. There is a slight concern with the PSA blood test, which is what you typically would have as part of a prostate check. It's a blood test, but it is a marker which can also be, in many cases, falsely elevated. So it can cause a lot of additional stress, namely because it's raised after vigorous exercise, especially things like cycling, even after ejaculation, so after sexual activity for 48 hours, and after certain types of infections. So there can be additional stress and additional burden put on the healthcare service and GPs and the like after somebody goes to see them, has a raised PSA. I think the important thing is actually looking at trends and building up the bigger picture. So I think somebody should get their PSA checked if they have concerns about their prostate. And probably that is going to be beyond the age of 40. Typically, we don't see men in their 20s with prostate cancer. And there's a very good, we can talk a little bit about the kind of the controversy with testosterone and prostate cancer as well, and this all stems from, I think it's something in the 40s. There was literally one study where there was one man who was on testosterone replacement, and I think it's not exactly clear, but there was at some point identification that he got prostate cancer, and because of that, the medical community at the time then deemed it to be unsafe, and testosterone is linked with prostate cancer, and that has stuck for nearly 80 years.
That's mental. One study, one man.
Yeah, that's where it stems from. And I think, sure, there might have been some replication, but there have been now countless studies. And the latest one, which is sort of from about 2 or 3 years ago, but it's also been replicated in about 15 odd countries, actually shows there is really no association with testosterone levels and prostate cancer. There is, and to explain it a little bit further, so the prostate has androgen receptors, but these receptors do get saturated with kind of circulating testosterone. Once testosterone levels have reached a certain level, which is quite low, to be honest, it's somewhere between 8 to 8.7 nanograms per milliliter, those sites are saturated. So you could, and that's still a low level of testosterone. So to get a man into what is deemed a normal range of testosterone, be that on treatment or if they have that normally, that's not going to have any impact at driving any growth at the prostate because those receptors are saturated. So yeah, the latest evidence is very positive on that, and I think hopefully does dispel that myth. That is a myth, actually, that TRT can cause prostate cancer. Should one be careful if they have had prostate cancer treated and then are looking at TRT? Sure, I think one should be careful and obviously speak with their healthcare provider about it. There are always, unique cases and nuance, and obviously I'm not providing generic medical advice here, but I think things like this are really interesting, and there's been a few conferences lately in the past year or two where this is now being, the awareness of this has been raised even in the medical community. I literally had a good friend who's very good doctor himself, not a specialist in men's health, who was actually quoting to me this study from like 2 days ago. So it's like, oh, isn't that fascinating? There is a link. I was like, yeah, it is. It is fascinating, but it's also such a shame that there is this stigma.
Yeah.
I mean, that's only one angle of the stigma on testosterone, but from 80 years ago.
Yeah. And if we go back to basics with testosterone, what's the role of testosterone for a man, and what can happen if your testosterone levels are perhaps not where they should be? How can it affect your organs, the way your body functions? How could it make you feel?
So I think the way I like to look at it is with a bit of context as well as maybe just explaining what testosterone is. So it's the primary androgen. So it's a hormone. It's the primary male hormone. It's responsible for several things, sexual characteristics and development, but also physical and mental as well. And it's always quite nice to look at what the impact is starting from kind of going from childhood into man. So puberty. Puberty is a really prime example, because if you look at the development from boy to man, essentially what happens, you get physical changes, but obviously there's a lot of sexual changes. There's also a lot of mental changes as well. And that is primarily driven by testosterone and other things as well. But so that's kind of what testosterone leads to, right? So, you get lengthening of bones and obviously it is responsible for kind of promotion of good bone density, jawline, etc., hoarse voice, deepening of the voice. There are skin changes as well, and too much can lead to acne, promotion of muscle, so it's anabolic, and lean mass as well, burning adipose tissue, so helping with sort of minimizing fat gain. And energy levels, that also means lots of things to different men, but typically we hear people talk about their drive, their vitality, even their resilience. From a mental perspective, there's also that kind of can be responsible for kind of concentration levels, and then also their mood as well. And what we do see with deficiency is essentially the opposite, okay? So that those things would be lacking. So you will see typically people will physically complain about weakness. That might be aches and pains in their joints and the bones, and issues with muscle gain, probably losing muscle or going to the gym and they're saying, well, actually, I'm not putting on any muscle anymore. Fat gain, or it's actually now harder to burn that fat. And I think none of this is rocket science, because again, if you think about it, you just look at what sort of people complain about in their 40s versus what they complain about in their 20s. And it's not uncommon to say men typically go, yeah, actually, why is it so much harder? Now I've got a beer belly and I've got a dad bod, and all these terms really do stem a lot from the impact of testosterone and what happens. And all of this is natural as well. Mentally as well, maybe not feeling as sharp, complaining about brain fog. Mood can be feeling low in mood. Now, it's very important to kind of highlight that, depression and mental health versus kind of the impact of, say, low testosterone. So low testosterone can definitely lead to feeling low, which can also, in some cases, be misdiagnosed as depression. I have seen that. We've seen, several men over the years with, come to us and say, look, I was put on this antidepressant by this doctor and another one, and then I tried this and that, and none of it worked. And that's what's quite interesting is then revisiting these patients many years down the line, and actually when you hear they've actually succeeded with TRT, but also have stabilized and not needed antidepressants. I say that because there is also a use case where there can be some benefit where somebody is found to have low testosterone, so be biochemically hypogonadal, but also may also have depression as well and be on an antidepressant, and also then be put on TRT and also see some benefit. And the TRT can sort of work synergistically with the antidepressant, but it's not solely responsible in that person's case for getting them out of depression. And then obviously from a sexual perspective, so which we didn't touch on yet, but from puberty, obviously that's the real development of kind of the sexual characteristics of a man. But actually what happens is that typically when testosterone levels drop, one of the first signs and symptoms that, again, men are typically quite embarrassed to talk about, but actually it's quite commonplace, is kind of erectile dysfunction. And that typically manifests as loss of morning erections. So again, most people will, so men will be very familiar in their teenage years of kind of, waking up, morning wood. It's kind of that's very common, and that's largely responsible due to circulating testosterone levels. Obviously, that for many men will probably decrease because testosterone levels tend to kind of peak in the 20s.
Right.
And then from the mid 30s to 40s onwards, will start to decline.
Is it a slow decline?
It is, but there's always caveats.
Yeah.
But compare it to, say, menopause, for example, where hormone levels are, there's of course, again, for each woman, it occurs at slightly different times, and the there can be huge differences from one woman to another, but with men and testosterone, it's a very gradual process. So I sometimes take a bit of umbrage with the term, kind of andropause, because it's not, again,
menopause.
Menopause, exactly. Yeah, exactly. And it's not completely accurate, but and I think also to try and make it sound similar, it's not. They are two different things.
Yeah.
But if we talk about it from a kind of hormonal health perspective, and obviously what occurs for women, so menopause, and what's the equivalent for men, well, yes, I guess you can look at the kind of the decline. Why do I say caveats? Because we do sometimes find that some men younger than maybe in their early 30s might start experiencing a decline and be biochemically low. There can be medical reasons for this. It could be, so without going too deep into the science just yet, at least, essentially, the hormones work on an axis, typically starts in the brain. So you've got the hypothalamus and the pituitary, and there's typically lots of different axes. So there's the HPA, which is hypothalamus, pituitary, adrenal. There's the HPG, hypothalamus, pituitary, gonadal system or axis. So there can be disruption at various levels. And I think one of the nice fun things as a doctor to try and unpick the puzzle is to identify from tests and other things where the issue could be. So it can be a central issue, it can be an issue down at the gonads, and again, you can sometimes unpick reasons for that. So a history of head injuries and concussions might put someone more at risk for potentially having some disruption at the hypothalamus and pituitary. Similarly, at the gonadal level, so any issues with, say, particular, testicular cancers or surgeries, or even kind of pelvic, surgeries and operations can have some impact. And then, of course, this axis works on a feedback system, and there's hormones involved in that as well. So, and blood tests can help a doctor kind of unpick and say what's responsible. And other things also, it can sometimes be the case that following having done blood tests, a doctor like myself reviews things and actually identifies that certain things are high, maybe your prolactin level is high, which could be indicative of a pituitary tumor, a pituitary adenoma. And that might mean that somebody actually needs to go off and have an MRI. And then there are even genetic factors as well. There are some genetic disorders that in some cases are quite subtle from a phenotype perspective, meaning that someone hasn't physically felt different, but might actually have some sexual differences that actually lead to them potentially having issues with their testosterone and potentially even with their fertility as well. And there is obviously a quite key link with testosterone levels and fertility as well.
That's really interesting. And in terms of lifestyle, I know obviously TRT can be very helpful, and it's good to, I guess, if you're having any of the symptoms you've described, to go and get your testosterone levels checked. But are there any lifestyle factors that can help? So if you exercise regularly, if you work out, if you build muscle, eat lots of protein, if you sleep well, like, do these things help your testosterone levels as they would for a woman who's, wanting to regulate her hormones?
I think absolutely. I think sadly, in years gone by, medical schools weren't very good at advocating about the real importance of lifestyle medicine as it's kind of come to be known. And I think if you look at the NHS website for lots of conditions, I'm sure you have probably at some point, but it's not particularly informative. And the lifestyle advice is usually pretty standard stuff. It's just like drink more water and do this and do some exercise. It's not, and of course I know it's on the flip side, it's also got to be so generic that they can't be putting too specific advice that can't be sort of read by the general population. But so But actually, absolutely. So lifestyle factors play such an impact. I mean, if you want to break things down by kind of, you know, the different pillars of health, so to speak, but like diet and nutrition is a huge factor. If someone is not eating well, full stop, and we can get into what that means, that can have a factor. If someone's not sleeping well, sleep is such a big predictor for certain diseases, as much as it is a restorative and protective factor against certain conditions and diseases, and a stabilizer, if you like. So many things: metabolic disease, cardiovascular disease, things we've already spoken about with men, but also in terms of hormonal health as well, and regulation of that. Stress, which I think sometimes can be linked with sleep as well. You know, often disrupted sleep leads to high cortisol and stress, and usually people who are highly stressed are probably not sleeping very well. Toxins, although I don't love that term, but that can really just mean any type of chemical in our environment, and that can be from foods and processed things that we put into our body, but also can be you know alcohol, drugs, smoking, etc., because that all puts an added stressor on our body. So I think those are kind of four key things. But yeah, I think definitely that's the lifestyle factor cannot be denied, and I'm very vocal whenever I do consults with patients to talk about it. And I often feel, and I won't spend only a couple of minutes on it. I'll try and spend as much time as I can, but sadly often we have to end up talking about blood tests and so many other things, and there's just not enough time sometimes in the world to really give it its dues. But it's something I'm trying to do more and more of, because quite often we do see incremental benefit. So even if a man does end up on TRT, what can lead from their levels fluctuating month on month, or typically we don't check it month on month, but quarterly, maybe those lifestyle factors. So it's such a big...
It's hugely important. Factor. I'm really glad that the message is getting out there. Although I do feel like a lot of men, I have friends, partners, they feel their partners are not looking after their health in a way that they are. Perhaps the wellness industry has appealed more to women, perhaps for, sadly, aesthetic reasons, over the years, where losing weight and things, but actually it's moving more into like a longevity health sphere, which is great. And hopefully, that message is also getting out there to guys as well. I'd like to ask you about erectile dysfunction as well. I know we've obviously mentioned it already, but I've read that it can be a real sign that there are other health issues going on with cardiovascular stuff. If you are suffering with erectile dysfunction, what could that mean for your general sort of cardiovascular health? There's
so much stigma, as you say, around this for many reasons. And I think it's really important to actually look at things holistically. So quite commonly when we talk, just like the question you've asked, erectile dysfunction, it almost pigeonholes you into just thinking, oh, well, the problem is just down there at, at the level of the penis, and there's an issue from a sexual perspective, right? Erections are needed for sex, and therefore it's not actually responsible for anything else. But actually it's so much more from that. There's probably quite a bit to unpick, but very simply at a macro level, it's kind of, are there circulatory issues? Okay, is it a blood flow issue? Is it vascular? It could be the case that erectile dysfunction picked up early enough could highlight problems elsewhere in the body from a circulatory perspective. So it can be a very good early predictor for cardiovascular disease. And we are finding, and there are studies that show, on average, ED can predict heart disease and even heart attacks in 3 to 5 years in advance of the event. So a provider, maybe a GP, maybe a private provider, who actually finds a patient coming to them for ED problems, it's all well and good saying, okay, have some Viagra, but actually there may be more there. Sadly, we've seen, I've been involved in it myself, in a lot of kind of healthcare providers in the last few years who have seen a huge uptick and surge in selling ED meds online. There's huge demand. They can't get it. Well, maybe they can get it from a GP, but it's very taboo, and often you won't get a lot as well. You probably only get like a few tablets as well. So there's the convenience factor to it, et cetera, et cetera. So there's a huge uptick in obviously seeking these sorts of medications online. And of course, yes, it has to be done appropriately and safely and through regulated channels, of course. But there is also an aspect that just just dealing with that and just giving them PDE5 inhibitors, so your Viagras and your tadalafils and stuff, is not the full story. Actually, it's worthwhile identifying those patients because there could be more serious problems like cardiovascular disease, and that could be the only warning sign that you get. And we spoke about how men typically won't turn up until they end up in the ambulance with their heart disease. That could be your one shot at it. It could be also psychological as well. I think, again, we're not good. We're much better now than maybe what we were 10, 15 years ago, generally thanks to, better awareness of kind of mental health in general. Psychological factors play such an impact across so many things in kind of one's health, but especially from a sexual perspective. And obviously there is that component when it comes to erections as well. And I think that probably is actually more of a factor as one gets older than it is for a teenage boy.
So really, I guess, obviously Viagra can be helpful, particularly later in life. But is there an age where it becomes more normal to take it? Like, is it something that's quite common to be taken over the age of, 50, 60? But younger than that, it can be a real signal that actually something's wrong.
That's probably a bit of a good summary there. I mean, yes, traditionally you'd probably find that as men get older, they're more likely to experience ED and therefore benefit from a medication like Viagra or alternatives. Typically what we do actually at TEDS Health is for men who are on TRT. Not only for men on TRT, actually, one of the things we sometimes identify when I do a consult and find that the bloods are actually biochemically normal, so testosterone levels are normal, but actually from what they say, maybe there are some ED issues or maybe it's not so clear, but actually we look where possible and if appropriate and with patient buy-in at prescribing a medication called tadalafil, which is very similar. So Viagra's generic is sildenafil. Tadalafil is in the same class of medicines, phosphodiesterase 5 inhibitors. It's a slightly longer acting preparation. So whereas Viagra is something one would take in advance of the act, 30 minutes to an hour before, for kind of spontaneous use, tadalafil is kind of either for kind of just planning ahead in general, but actually we advocate for kind of a low dose, but daily. And there's real benefits to be seen from taking it at least 4 days in a row and continual. If you take it for, say, 2 days and 2 days on and 2 days off and 2 days on, 2 days off, you probably don't see the real benefits. But it can lead to some improvements in testosterone levels. Not huge. We have seen sort of modest improvements in some men's total testosterone by 2 nanograms per milliliter. Solely by that. Plus, obviously, good lifestyle factors. So I've seen some men who've been on tadalafil daily for the last couple of years with us, and they do an annual check-in with us, and it's quite interesting to actually see the trend actually is going up, which, like I say, for someone who might be in their 50s or 60s, we have an average age of 52 as our patient cohort, but quite interesting to actually see that levels could potentially go up.
Wow.
When I said to you that typically levels are declining about 1 to 2% a year from the age of 35 to 40 onwards. But what I do say, and I make a big long spiel about it when I talk about it, is it's not only for ED. Obviously there is a benefit there, and the principles of kind of why and how that helps kind of relaxation of the smooth muscle, allowing kind of better blood flow and for erections, but also leads to kind of better blood flow generally around the circulatory system, and that has a benefit from a cardiovascular perspective as well.
Yeah, okay. So going back to TEDS Health and some of the key issues that we've spoken about, testosterone, erectile dysfunction, if someone is interested in looking at the services, like what are the main issues that you might offer assistance for, medication, potentially consultations as well? So
we take a full spectrum approach. So we are doing blood tests. So that's obviously the biochemistry. We do consultations where a clinician actually speaks with the patient, and then we go through everything, including their lifestyle. As alluded to, I think that's such a big factor. Even if someone's testosterone levels are normal, there could be benefits from changing their lifestyle, optimizing it. We talk about things like supplements and diet, sleep, nutrition, and exercise as well. So it's really a full 360 holistic approach to men's health.
In terms of looking forward, obviously TEDS Health's on a mission to make men's health more accessible. But what's your hope for the future of men's health? Say 10 years' time, where are you hoping things will go?
Well, if you look at women's health, there was kind of a HRT revolution sort of 10, 15 years back. I would hope in about 10 years' time we have a similar one for men's health.
Mm-hmm. I love that answer. And I'm with you. I feel like it's been really great to discuss this. And it does feel like things are starting to shift. I have had people on the show, guys, where when I've asked them their view on men's health, they've been quite down about it, saying actually not very hopeful at the moment. So I feel like what you guys are doing at Ted's Health is really important. And hopefully any guys listening now who might have concerns can reach out, book a consultation and start that investigation. And I do think part of this is about us kind of being detectives for our own body and finding that sort of in-tuneness and investigating what could be causing this potential symptom. And I really hope that going forward, men will have the confidence to do that work and not feel embarrassed. Hopefully the taboos will shift. For people who want to follow you, Jonathan, where can they find you on social media? Where can we find Ted's Health?
So Ted's Health website, tedshealth.com. Also on socials, Instagram, LinkedIn. Similarly for me, LinkedIn. A little bit on Instagram, not such in a big way. But
Dr. Jonathan Andrews, thank you for coming on the Health Review.
Thank you so much, Emily. It's been really great.